Good evening,
Yes.
everyone. And today we are going to be talking on about advanced vulvovaginal techniques, which are surgical and minimally invasive. Okay, so we are going to understand a little bit of anatomy, which you guys already have probably gone through, some clinical indications, what to consider when it comes to ethical and moral grounds, and then we will go in and see how to manage it surgically and minimally invasive. Okay. So, firstly, we need to understand what is labia majora. Labia majora is a skin fold, if you see in the diagram, is in between of the two thighs, and it protects the introitus and the vulva, which has the opening of urethra and vagina. And even the clitoris is at the superior part of it. So, when we know it is a multi layer, it might just look like a skin fold, but there are a lot of layers which we need to keep in mind when we in when it comes to anatomy, and when we surgically intervene we have to keep all of those layers in mind. Okay, so first is of course the skin that we see outside. Okay, and on the medial side of it is the mucosa, and then it is made of adipose tissue. It has superficial and deep fascia. We have to remember that it gets its blood supply from the internal pudendal artery, which it supplies from the inferior part of it. Okay, so when it enters at the inferior border of this labia majora and it goes superiorly, and the nerve supply comes from pudendal nerve. So when we have any sort of injection or any surgical intervention, you have to keep the blood supply in mind so as to not injure the nerve neurovascular bundle, nerves or the vessel, and that will help us in reducing complications. Now, the major goals of why you are going to be seeing this patients in your practice is somebody who is very unhappy with how it looks. Now, this could be a young patient.
Are transforming women's health by functional restoration aesthetic enhancement. These evidence based procedures are designed to improve both patient comfort and confidence. Today's advanced approaches include regenerative therapies, energy based technologies, minimally invasive surgical techniques, and personalized treatment planning for optimal clinical outcomes. Enhance your clinical expertise with structured training in advanced vulvovaginal techniques and stay at the forefront of modern cosmetic gynecology through evidence based practice.
Now, when we've already spoken about this, then there is laxity. Sometimes there are these new methods which are called PDO threads, which is polydioxanone, which you know is delayed absorbable suture material. So, what it does is it lifts the hanging tissue up. You must have heard of thread lift, facelift, right? Where they put it on your face and then the face is lifted up with the thread. So it's a very, very similar concept, just used in the vulva region. So it's called genital thread lifting. What is done is these threads are inserted subcutaneous, and they are barbed, so they are small little hooks on the whole suture line. So then once they're put inside, it gets stuck on the surrounding tissue and then it's pulled up and then it stays there. So that is how it helps in lifting. So depending on where the laxity is, you can either pull it up or pull it down, but the ideal most favorable thing is to do is pull it up. All right. So what happens because of these barbed sutures is there is mechanically it's being lifted up. Okay, like if you're lifting something. Also at the same time, these threads have an effect on new collagen synthesis, which you will see eventually over 6 months to 1 year. So that new collagen which is being made also helps in rejuvenation and gives good support to the tissues. Now, but this, if there's severe laxity, it's not going to hold it up. It's just going to wrinkle and eventually fall down again. It is just for very mild to moderate, say someone in the 40s. Someone in the 60s might not be a good candidate for this procedure. Also, this is temporary. You might see the redundancy reappear again in probably a year's time, and they might have to undergo this again. So, they have to be told that this is not a permanent solution and it is a temporary fix.
Genital thread lifting is a minimally invasive aesthetic procedure that uses absorbable threads to provide immediate tissue support while stimulating the body's natural collagen production. Once placed, the threads anchor within the connective tissue. Their mechanical support elevates lax tissue, while controlled fibroblast activation over the following weeks.
The combined mechanical lifting and collagen regeneration improve tissue firmness, contour, and structural support. Appropriate patient selection and precise